Hi, my name is Dr. Kuang with Ideal Body Chiropractic, and welcome back to another Anatomy of Pain video. In this series of videos, I go over the anatomy of common structures located in different parts of the body that can cause you pain. I then go over the more common ways that people go about injuring these muscles and structures, and then I end with some at-home remedies to either take away the pain associated with these structures or to prevent these pains from coming about in the first place. And in today's video, we'll be talking about a very specific muscle called the quadratus lumborum, or the QL for short. Okay, so let's talk a little bit about the anatomy of the quadratus lumborum muscle. First, we'll touch on the attachment sites, the origins, insertions of the quadratus lumborum. Then we'll go over the movements that the quadratus lumborum is responsible for. And then we'll talk about some important neighboring structures that get affected by a tight or injured QL muscle. Okay, so this is the back of the body looking towards the front, and I'm going to zoom in so you guys can see the QL muscle a little bit better. It's located right there. It's highlighted in blue on your screen right now. The origin of the quadratus lumborum is at the bottom portion of the 12th rib. It then courses down the entire length of the lumbar spine and attaches or inserts onto the top of the ilium, which is one of the 3 pelvic bones. Along the way, when it goes through the lumbar spine, the QL muscle also attaches to each and every lumbar spine via the transverse process. The transverse process is just a bony outgrowth of the lumbar spine, indicated here by the color red, and it's highlighted in blue on your screen now. Okay, but the atlas has chosen red on this very specific portion of the atlas to show you that transverse process. Okay, so when this muscle gets tight, the quadratus lumborum, because it crosses many lumbar spine joints, can create compression to the facet joints located on the back of the lumbar spine vertebra. Okay, so let's move on to some of the movements that this quadratus lumborum muscle is responsible for. In your body, you have 2 quadratus lumborum muscles, one on each side. When both of those muscles act in unison, the QL muscles create stability in the lumbar spine by maintaining the lumbar spine in neutral position, thereby hopefully preventing any injury from occurring. However, when the muscles act independently of one another, when you contract one and not the other, it's responsible for side bending. I'll go over these examples during the next section of today's video. Some important neighboring structures to the quadratus lumborum. The first one being a nerve called the lateral femoral cutaneous nerve. Okay, so that lateral femoral cutaneous nerve is highlighted in blue on your screen now, and as you can see, it lies in front of that quadratus lumborum muscle. Again, let me rotate it towards the back, zoom out. Okay, so this is the quadratus lumborum muscle, highlighted in blue again, and if I rotate it towards the front and zoom in, you can then see that lateral femoral cutaneous nerve lies directly in front of that quadratus lumborum muscle. So if this muscle, the QL, gets tight, or if it gets injured and has scar tissue formation and shortens, it'll create a compression on this lateral femoral cutaneous nerve. Now, this lateral femoral cutaneous nerve, the name of it tells you exactly what it's responsible for. The word cutaneous means skin, right? The word lateral means towards the outside, and the word femoral refers to the upper leg, so the femur. This nerve is responsible for sensation of the skin on the outside portion of your upper leg. So if you're starting to feel some lower back pain and you're also experiencing some numbness and tingling that coincides with it off to the side upper portion of your leg, then that's a very typical presentation for an injury to this quadratus lumborum muscle. Okay, so another very important nerve that this muscle can influence is called the femoral nerve. Okay, so the femoral nerve is actually responsible for the sensation off towards the front portion of your upper leg. If you can see kind of where that blue nerve goes towards, you can see it kind of goes towards the front of the leg. It's responsible for sensation to that area. Another thing that it's responsible for is the contraction or the innervation to the muscles that extend the knee, that straighten the knee. Okay, so some common presentations and symptoms that come from compression to this nerve is numbness towards the front of the leg and a weakness to the muscles that straighten the knee. Okay, so that is the brief anatomy lesson that I have for the quadratus lumborum muscle. Let's now jump to common ways that people injure this muscle. Here are a couple of examples of how the quadratus lumborum muscle can become injured. Here you see me sitting on the couch in a slouched position. What this position does is it keeps the QL muscle in an outstretched position, thereby decreasing circulation to it, then also decreasing the amount of metabolic waste products being taken away from that muscle, eventually leading to a strain or a tightening to the muscle, compressing the lumbar spine, creating a lot of the pain that many people feel. So instead of sitting on the couch with that lumbar spine in a stretched out position, what you'd rather do is to sit upright and have your spine more in a neutral position as shown here. Another way that the quadratus lumborum muscle can become injured is by actually sleeping on your side. What tends to happen here is sleeping on your side sinks the torso portion of your body downwards towards the mattress, thereby stretching out that side's quadratus lumborum. Not only are postural problems an issue for the QL, you also injure the QL if you lift things up off of the floor improperly. Here you see me lifting a kettlebell off the floor with a rounded back. Using the muscle in this fashion can lead to an overstretch injury to this muscle. A better alternative to lifting whatever object you want to lift off of the floor is to lift it with a neutral spine. Here you can see my lumbar spine is nitro neutral. I'm hinging at the hip and I'm pushing my hips backwards as my shoulders go forward to lower my body downwards towards the kettlebell. Another alternative is to perform more of a squat type of position. As you can see here, again, my spine is neutral. I'm dropping my hips down towards the object on the floor. Let's move on to some things that you can do to help the quadratus lumborum muscle recover. As you can see here, I'm performing a quadratus lumborum stretch. You sit with your feet firmly planted on the floor. Your arm comes downwards onto the inside of the shin, and you're bending your body downwards towards the floor while reaching up. Here's a doorway stretch. As you can see, I'm crossing my legs. I'm holding on to the doorway and I'm pushing my hips away from the doorway, opening up the space between my rib cage and my pelvis. You should feel a long stretch along the side of the spine. Here's just a back view of it so you guys can see it from a different angle. All the stretches that you see here, you want to try to hold anywhere from a minute to a minute and a half. Now I'm showing the placement of the foam roller where you shouldn't put it for our next clip. Don't put it in the middle of the spine like I'm showing here. What you really want to do is place it off towards the side of the spine, thereby compressing the quadratus lumborum muscle and not the spine itself. As you can see, again, the foam roller is off to the side of my spine, and what I'm doing is I am planting my foot firmly against the floor, and then I'm using that foot to tilt my torso towards the foam roller. What this does is it almost peels, so to speak, the quadratus lumborum muscle up off of the spine, creating some room for the quadratus lumborum to be able to stretch. Hopefully you guys have found this anatomy of pain video for the quadratus lumborum useful. Please subscribe to our YouTube channel for more videos. Hit that like button if you enjoyed what you saw, and leave any comments that you might have on how these videos have helped you decrease your pain. Thanks for watching.